The take-home message here is that the pandemic is seriously damaging our ability to take care of all of you. Our dedicated, generous caregivers, patient care associates, environmental services people, nurses, doctors, are exhausted and they need your help. The single most effective thing you can do is get vaccinated. If you are still concerned or unsure, take some time to talk to your doctor. And know this, everyone in North America is either going to get vaccinated or you're going to get COVID.
We've seen three of the last 4 weeks have had the highest number of cases for hospitalization since early 2020. Today, across our system, we remain at or near our peak in terms of the greatest number of hospitalized patients. Last week, 23 people, 23 members of our community died from COVID in Bronson hospitals, and that's the highest number of deaths in the Bronson system since the beginning of the pandemic. We're seeing an increase in younger people who have serious COVID disease. For those under 60 years of age in our hospital right now, the vast majority, nearly 90%, are unvaccinated. As Dr. Ross alluded to, our people are exhausted. Despite the amazing skill and dedication that our team shows up with every day, both as members of the healthcare team, but also as a member of this community. The resulting healthcare worker burnout, which is a second pandemic that's affecting this community, will have negative impact for years to come.
We are facing challenges we've not seen before in this pandemic or truly ever before. I need to recognize the strength and commitment of our staff who are working in ways and at an intensity level they have never had to before. The last several weeks, we've had rising concerns with the total number of patients we've been seeing in our emergency departments and at our express care sites. The wait times have risen and the number of people who leave without treatment climbed, many of those who truly needed care. We are limited by having few to no beds to admit to, either at OAKLAWN or any of our referral hospitals nearby. Our staff calls more than a dozen hospitals to seek beds, and we transfer patients as far as the Detroit area to get services we cannot provide. While awaiting beds, our patients are boarded in the emergency department, where we have nurses and doctors not accustomed to providing inpatient care.
We need your help. What is happening right now in our healthcare system is an unprecedented number of COVID-19 hospitalizations and non-COVID-19 hospitalizations. This affects the entire community's health. It affects your individual health. It affects your family's health. What our community is experiencing right now is preventable suffering. And that's hard. It's hard on patients and their families, and it's hard on the caregivers, our healthcare workers who are caring for those individuals and families. A core challenge throughout the entire pandemic for our community and for our nation has been trust. Who do we trust for information? Who do we trust to inform healthcare decisions? I'm reminded of what Dr. Albert Schweitzer once said, which was, the only way out of today's misery is for people to become worthy of each other's trust. Historically, we in healthcare may not have always been worthy of your trust, but the community physicians gathered here today live here. We work here. Our children go to school here. We've been there with you in times of joy, at birth, at times of wellness. We've been there with you when you're scared in the intensive care unit. And we've been there with you at times of grief, at times of loss, and at times of death. We've been keepers of your trust for your everyday healthcare needs. And we ask for your trust now about COVID-19, about the COVID-19 vaccine, and what is happening in our healthcare systems.